Hello, my name is Miles Price and I'm from Life Clinic, and today we're going to be talking about Hashimoto's disease. Hashimoto's disease is an autoimmune disorder of the thyroid gland. It's probably one of the most common autoimmune disorders found in the body. It is characterized by a variety of different symptoms, including fatigue, weight gain, constipation, feeling cold in the extremities, muscle aches, hair loss, and rough, dry skin. Patients who experience these symptoms are generally tested for their antibodies, the anti-thyroid antiglobulin and thyroid peroxidase antibody. And these are antibodies which are raised in blood tests and give the diagnosis of Hashimoto's disease. The conventional approach for treating this disease is by using thyroxine or a combination of thyroxine and T3 hormone. What this treatment does, it actually raises the level of thyroid hormones in the body to reduce the symptoms. However, what it doesn't address is the antibody production by the immune system against the thyroid. So what happens over a period of time, the patients become dependent on the thyroxine medication, whilst at the same time the thyroid cells are being destroyed by the antibodies. So this is not the long-term solution we need. In functional medicine, we take a different approach. And the approach we take is to try to understand why the immune system is attacking the thyroid gland in the first place. And what we gathered over the years is lots of research to demonstrate what's happening with the immune system and why it does what it does. So first up, we've identified from the diet that particular components can trigger autoimmunity. And the first one of those is gluten. Gluten is found in wheat, barley, oats and rye, and when consumed it actually creates a leaky gut. A leaky gut is when the barrier in the intestine becomes weak and it allows substances to go through which shouldn't be allowed. And these substances trigger the autoimmune response. Second of all, patients may have latent viral or bacterial infections in their body. Whilst not producing symptoms, what they are creating is the autoimmune response in the thyroid gland. Toxicity is very common these days, and toxicity coming from heavy metals and environmental pollutants like mercury, lead and so on can trigger the autoimmune reaction. We can also get autoimmune reactions from stress and adrenal fatigue. So too much cortisol going around in the body actually weakens the immune response. If a patient has a history of eating disorders or is over-exercising, this can also trigger an autoimmune response. And finally, we need to be looking at the nutrients levels in the body. So if the patient is deficient in iodine, selenium, zinc, iron, vitamin D or vitamin A, a combination of these deficiencies can actually trigger an autoimmune reaction or weakened immune system. So by looking at all these factors in a systemic and clinical way, by testing using particular laboratories, we can identify where the weaknesses are, where the imbalances are, and by correcting them, we can tame the immune system down and lower the antibody production. When the antibody production gets lower, then the normal thyroid production of hormones actually resumes. So what we're saying here in the treatment of Hashimoto's is a combination of the conventional and the functional medicine approach. By treating the symptoms with thyroxine and by addressing the actual underlying causes, we can actually help the patient get better for long term. Thank you very much.